have Ebola, so they brought her to the hospital. The girl has been suffering from fever, headaches, nausea, and diarrhea. The parents did the right thing by bringing her to the hospital. Now, we cannot tell if she has Ebola without testing her blood. We drew her blood and sent her blood sample to the laboratory in Entebbe. As we wait for the results, we are providing supportive treatment to give her the best chance of survival. This happened a few weeks ago. The girl had indeed tested positive for Ebola, but she's fine today. Patients with Ebola can be treated and they get cured if they are brought to the health facility as soon as the signs are seen. This girl recovered because her parents brought her to the clinic early enough. It is important for the rest of the community to learn how to protect themselves from Ebola. One can get Ebola through touching someone who is infected or their bodily fluids, including blood, saliva, vomit, urine, and sweat. Please don't touch these people, but report them to the nearest health facility immediately for appropriate management. Ebola can also be transmitted through touching or eating meat of some wild animals, especially monkeys and bats. Avoid such meat to prevent Ebola. Lastly, you must not touch anyone who is suspected to have died of Ebola or one who dies suddenly from an unknown cause unless you are wearing protective clothing. A professional burial team must help to bury anyone who dies of Ebola. Ebola corpses are infectious. You must visit your local clinic and get checked for Ebola if you are having these symptoms: sudden high body temperature, severe headache, feel weak and tired, abdominal pain, vomiting, blood in diarrhea or urine, bleeding from the nose, eyes, ears, and mouth. Please remember, Ebola is a deadly disease that can kill in a short time, but can be prevented. Wash hands with water and soap regularly, especially when in health facilities. Be on the lookout for anyone who has signs of Ebola and get them to the health facility immediately. Do not reject people who have recovered from Ebola. Treat them with compassion. Do not bury anyone who has died of Ebola. Leave the burial team to do it. Together we can keep Uganda Ebola-free. Report all suspected cases to the nearest health facility immediately. For further information, send a free SMS to YouReport on 8500 or call toll-free on 0800 100066.
Yesu ke tugenda maaso ekyatandika butandisi mbufunzi atenete era batugamba Albert Yanga yakutusizaako entandikwa kwa filime egenda maaso mpola sala kunyumiriza onywereza egenda maaso songa munaye ku mulundi guno tandikide tulengera waliwo abalinze erudda ekyatandikwa balinze eki wetegereze kyekyo olowooza si kyekyo basi sawa yakola mulimu kigo bagendako guno ogw'okusooka okwekamirira n'agamba jjukira ebbanga nalwe tukola bulungi nze naawe tuli ttiimu y'amaanyi kati wekamirire naye nze nga ntisigadde omanyi omulimu guno mukambwe omusajja alina ogukola njagumaliriza bananga ate lwaki asaze obwati mulimu ki akabonero k'omulimu bubadde buwundo kati kirike byekamirira kibafuula ekikulemme Shalini Choi ekyatandika tazegenda maaso mpolampola era tosubwa ekere Kyenge Addison Kyenge bonna kusukudini ntandikwa firimu tutandika butandise natenga bulijjo minza okuwereza ate nga bulijjo tulengera lwa train ine etuuse Mickey Haji John Wow and one ekyanitandikwa train erimu ki Magilo Mande Kyenge ekyanitandikwa egenda maaso ogenda okwetegereza okugulawo train teri avuga n'abasaabaze balinga abadduse special guest appearance ye mwana mulenzi Jackie Chan etandika butandisi Karen Moko ne special guest appearance Karen Moko abasaabaze mu ntambula eno baliwa Shani Hinkai ne Jack Nga